Well, here's the nuts and bolts. If a grapefruit was coming out your penis, would you prepare it? Therefore, the grapefruit's coming out your baby's mother's body, prepare her vagina. Simply said, you do it 5 minutes a day from 32 weeks onward. Your job is to feel where there's tension inside the woman's vagina and gently, that's with a capital G, capital E, capital N, capital T, capital L, capital Y, gently soften that tissue. The instructions are clear. You get to do it, and she gets to do it if she wants to. What percent of fathers prepare a woman's vagina to birth their baby? Birthing better fathers, probably 80 to 85%. Some families have religious restrictions on that, and that's fine. Others, for whatever reason. The reality is that you are already a father in pregnancy. Your baby is here. Your job is to do the best for your baby and your baby's mother. And helping your baby come through her body is one such thing. And helping your baby come through her body without being traumatized or without her body being traumatized is your job. And there shouldn't be any fussiness about it. For goodness sakes, you have sex. And it changes men. This is what fathers taught me. When we started to prepare the vagina for birth, what men were saying was simple. They saw the woman's body previous to pregnancy as a sexual relationship, along with all the emotional stuff and the partnership stuff. But it was a body relationship, a sexual, a cuddle relationship, an intimate physical relationship. But once pregnancy occurred, things changed. And as pregnancy advanced and the baby got bigger, and men suddenly realized this is a big object. We have to open up this container to let the baby out. There was no sense in just opening up the pelvis or softening the inside with the pelvic clock where the cervix is, that you had to work on that last passage, the vagina, and the baby's birth canal, whatever you want to call it. And it's not complex. It's basically a pocket, but it has soft tissue and muscles in there. And then the opening of the vagina is a tighter area, and that has to open up as well. So you can feel that, and you're able to work with a woman. And what did fathers tell me this did to them as human beings and as men? It changed their mindset from just seeing women as a sexual object to seeing women as the mother of their child, and that their job was to protect both the mother and the child. And by making certain that this last part of her body was not traumatized, that she was not left with lifelong injuries of either peeing every time she coughed or she ran or she laughed, or tearing or being cut, and the stitching not healing well, so she ended up having pain having sex with you. There are lots of things that happen in a woman's life down there, and one of them is giving birth. And you have the ability to help her prepare down there so that the last phase of the birth, the delivery, is really a gentle experience, or not an intense experience, and certainly not a delayed experience, and not a dramatized experience. So 80 to 85 of Birthing Better fathers do this. You're listening to a Birthing Better course, so you get to put yourself, hopefully, into that 80, 85%. You got to work with a woman on the audio. We'll teach you exactly how.